Hello and namaste. I hope you're all well and observing all the COVID 19 precautions and staying very safe. I'm Dr. Srinidhi Chidambaram, and I'm delighted to welcome you to the COVID Care series presented by Apollo Hospitals. Through these Facebook Live sessions, we are bringing you awareness, practical suggestions, and reliable and authentic advice on COVID 19 from our top specialists across our hospitals in the country. Pregnancy is indeed one of the most beautiful and cherished moments in a woman's life. It is a time of happiness, tranquility, hope, and dreams. Except that during the era of COVID 19, peace of mind has rather flown out of the window as the virus comes back again and again, making the world go into a tizzy as wave after wave comes up with its own features, with little periods of normalcy in between, and Omicron variant is the latest among them. So, uncertainty is what is ruling our lives now. Pregnant women are worried about getting infected, also about the baby being affected, about vaccination. So, the whole journey towards motherhood becomes a bit stressful. But it does not have to be so because staying calm is important in pregnancy, and a good way to do that is to understand the effects of COVID 19 and pregnancy and what to do to stay absolutely healthy. It's also good, perhaps, to take a moment and marvel at how quickly we have several tools to fight the virus. We now have the vaccines and the precautionary doses approved even for expectant mothers. We have the right treatment protocols, new medications and discoveries being made at astonishing speed even as we speak. So we are not now in the scary zone that we were in 2 years ago, but it never does to drop our caution as well. So let us talk to one of the top obstetricians and gynecologists in the country and understand what Omicron and the boosters mean for pregnant women. I'm delighted and honored to welcome Dr. Rooma Sinha, senior obstetrician and gynecologist from the Apollo Hospitals, Jubilee Hills, Hyderabad. With over 25 years of experience, Dr. Sinha is senior consultant gynecologist, laparoscopic and robotic surgeon, and perhaps India's most experienced robotic surgeon in gynecology. She's also honorary professor, Apollo Hospitals Education and Research Foundation, conjoint associate professor, Macquarie University, Sydney, Australia, distinguished clinician, Apollo Hospitals, visiting professor, AIMS Rishikesh, mentor for the Endoscopy Fellowship, the Butticuti Fellowship in Robotic Surgery, and the Foxy Endoscopic Fellowship, Basic and Advanced. Dr. Roma Sinha indeed has a flair for gynecological surgeries and a reputation for performing complex surgeries. The FIGO Fellowship in Laparoscopy, University of Rochester, USA, the Urogynecology Fellowship at Mercy Hospital, Melbourne, gave her international perspectives. She really pioneered robotic surgery in India and done the maximum number of robotic myomectomies, published several papers, edited several books, and has the distinction of being invited as a lecturer to almost every part of India and all over the world. Dr. Ruma, welcome. Can't think of a better guide to our expecting mothers at this challenging time. Over to you.
Namaste, everybody, and thank you, Dr. Srinidhi, for your kind words. Hello there, everybody. A very happy new year to all of you. And hope 2022 will turn the tide of this pandemic with our, and of course, the virus behaving well into a new era and bringing peace and calm and prosperity and happiness all around. So wishing you all the same for this year. I hope you've all remained safe over the weekend and avoided crowds and indoors because that's where the lurking problem is. Well, this virus has been there with us for 2 years. And as Dr. Swaminathan from WHO also says today, that we need to learn to live with this virus. So whether you are pregnant already right now, planning a pregnancy, not planning a pregnancy, just wanting to chill in your life, remember that this virus has become our friend. We need to tackle how to keep a little distance from the virus and how to keep us safe. So that's what is most important. But yes, Today, as Dr. Shinidhi also mentioned, this Omicron, the virus or the variant of interest, is what is looming large over us. The way the numbers have gone in our country in the last few days does definitely mean that there is a community transmission. Now, what do you mean when I say it's a community transmission? It only means that we have to stop worrying and thinking that only the travelers from abroad or a plane full of people are bringing this virus and we need to remain away from them. No, it could be to anybody around you. And that's what is where you don't need to lose your guard. You need to remember that you can fight it, you can protect yourself, and you can make sure you do not get this infection, especially when you are pregnant. And why so? When you are pregnant, we understand that your immunity is a little low just because you want to continue the pregnancy. The mother has to nurture the baby. And that's why the body's immunity comes down. And when your immunity is down, you're most likely or most susceptible to get an infection as the one standing next to you. That's the first thing. The second, if you get infection when you're pregnant, especially in the third trimester, we know that it can be a severe disease. You must be reading newspapers or you must be listening to many or internet and saying that, okay, this has been called a variant of concern, but it's a mild disease. It will come and go. But we don't know that. This virus has fooled us so many times in the last 2 years. It's important to remain cautious and it's important to remain aware and protective. Because in third trimester, and there are certain risk factors in pregnancy, like if you're obese, if you're elderly, if you already have some background medical disease like hypertension, diabetes. So these all bring you to the forefront of a more risk factor of developing more severe disease, especially in the third trimester of pregnancy. We also know that pregnant women who reach hospitalization, about 60 to 70% of them are unvaccinated. 95% of women in ICU requiring intensive care treatment who are pregnant are unvaccinated. So remember, you have a weapon in your hand and we can use it to our advantage. So we need to be very, very careful today and understand what in our Apollo lingo also we have been asking at COVID, protect yourself with SMS. Yes. And that has been, we have been telling in almost every session, and I'll repeat it again once for you. And that simply means that sanitize. That means make sure your hands are clean. And it's as simple. And in fact, when this pandemic came and I wondered, what are we thrown up with? But I said, okay, God has given us something better, just soap and water. If the poorest of the poorest to the richest of the rich have access to it, you don't need very special things to rub it off your hand. So make sure you wash your hands. Even if you have used sanitizer, it's a good habit that whenever you have access to soap and water, please wash your hand properly. Second, mask up. And today there is evidence to say that cloth masks are not sufficient. They may be beautiful. They may have all the nice things that show up on your face. Wear it over a surgical mask, minimum surgical mask. And if you think you are in a place which is very crowded, like you have to travel by plane or you're in an airport or a railway station, make sure you have an N95. So masking up with the correct mask that closes your mouth and out and is tight fitting is going to protect you. Now I understand that you're not used to it. So you'll wonder, how am I going to talk? How am I going to wear? But think of a minute. We as doctors wear masks for hours together to do your work. Or how are we managing? We breathe, we talk, we do everything. So I'm sure you can do that for yourself and protecting your near and dear ones as well. And the third, maintain a distance. It's a kind of not a concept which we have in our country. We like to be close to each other. You stand in a line, nobody wants to maintain. Everybody come and stand next to you. Tell them, stand a little bit. Oh, what's the problem? I can come. Now, you have to maintain the distance. And if you think the other person is not applying or doing that, you move away. So you can do that. You can lead by example. So maintain the distance, mask up, sanitize. 3 simple steps will protect you from getting this virus. And I think if you are pregnant, try to avoid getting the infection. Although in most of the studies that have come up, not specific to pregnant women, but in general, the Omicron is, although more infectious, that means one person can pass on to many more people, but it has not shown to cause very severe illness. But we don't know. We are still young. The first time it was diagnosed was last November. We are still just 1 month in Omicron. we'll have to see for the next few months how it plays.
So, so basically, do you think that this Omicron? Are there any studies going on at the moment about Omicron and pregnancy and whether it can cause complications, or do we have to assume that it does cause the same effects as the earlier variant?
Actually, Dr. Srinidhi, when we are talking, I know we are talking in this session about Omicron and pregnancy, but let's not forget that we did have Delta as our dominant variant till this Omicron business started, right? So the Delta is still there. Yeah. Delta is still there. And we know that Delta can cause severe disease. Yes. Right. So if you are pregnant, you must make sure that you don't get the infection. You can't choose whether you're getting Delta or Omicron, right? Yes. Okay. So I think we should not forget the Delta at the moment. We should have Delta in the corner of our eye, thinking which are the ones, and especially in pregnancy, if you get it could cause severe illness. Yes.
Yes. We don't. Just to refresh the minds of our viewers, what are the effects of the COVID infection itself in pregnant women, doctor? Could you just reiterate that again?
Okay. So as I said, pregnant women are at higher risk of developing serious disease. Pregnant women are not at higher chance of getting COVID as compared to any other woman. So if your sister is not pregnant and you are pregnant, you both have the same chance of getting the infection. But if you're pregnant, your chance of getting severe disease is much more than your sister. Look at it this way. The third thing that we found was patients who have COVID infection have higher chance of getting into preterm labor. So the babies can be born prematurely, and then the babies have all the problems of a premature baby. You can have higher chance of developing preeclampsia. You can have higher chance of having an emergency cesarean section. So these pregnancy-related complications are seen more often in patients who develop COVID-19 infection. However, almost half to two-thirds of patients in pregnancy, when they develop COVID-19 infection, they still have very mild symptoms. Some remain asymptomatic. Some just have a fever and a sore throat and get over. But for the few who can develop severe disease.
Absolutely. So you have already discussed how pregnant women can protect themselves. So it's really the same as everyone else. But are there any even more special precautions that expectant mothers need to do? Like, for example, we spoke about social distancing. So does it mean that, like during this time, they must kind of be at home, they should never go out, or do they have to be more careful about other people in the home having any mild symptoms? The problem with Omicron is they say if it's going to be mild, we also don't know whether, a lot of people would just ignore a mild body pain with some cold-like symptoms.
True.
So where should they be alert? How can they be more?
Okay. So again, I think over 2 years, we have now learned this, that hoarding everybody in is not really the solution. It had its own effect or benefit in the beginning when we didn't have these armors with us. Now we have vaccination, we have other things. As you said, we have protocols to treat. So we are much in a better space right now. But to pregnant women, I'll have one statement to say. Don't be at some place where you don't need to be. Okay? So if you need to go to somebody to meet and you think it's essential, go ahead. We are not doing a house arrest for you, or we don't expect you to be staying at home. But if you think I can do without going to the mall, then maybe you could. So use your judgment and your common sense and protect yourself. So we don't recommend that you should be sitting at home because you have to come out. You'll have to probably come out for your checkups. You have to come to hospital to see doctors. You have to come to get a scan done. So you please remain and do those activities which will keep you mentally sane is also important.
Yes.
Because depression, anxiety is at the peak in women, and especially when you're pregnant, you have double anxiety. So we don't want you to become mentally unwell as well. But double masking, avoiding indoors, big parties or big gatherings is something you should watch out for. And in travel, there is another one caution which I use myself, and I'll tell all of you, is that even if you have masked well, wearing a shield will protect you. So a face shield additional can help you, especially with this very infectious virus, the Omicron strain, because you can never say whether the person next to you is infected or not. Because try to understand now, two dynamics have changed. One, because a lot of adult population in our country are vaccinated, they may have an infection but may not have so much symptoms,
So they may
as you said. Yeah, so they may be an asymptomatic carrier, but they can pass on to you. So that's very important. The second is that the most infectious period is about 1 or 2 days before you develop the symptoms. So you may be taking a plane ride with somebody who probably will develop symptoms after they reach home, but they were infective at the time. So we need to protect ourselves. So, and many times others may not wear the mask so well. We can tell them, we can request them, but we can do for ourselves. So remember that.
Yes, absolutely. So we will now come to the topic of actually the vaccination part for COVID-19. So first, would you like to tell us about, what the pregnant women or people planning to become pregnant, feeding mothers. So what is we know that they do have to get vaccinated, but maybe is there still a lot of hesitancy, or do you think a lot of people are getting vaccinated?
I know. Getting vaccinated or not vaccinated at an adult age, which you are, is your choice. So nobody can force you to get a vaccination done, but it should be a choice which is informed. And so you should have all the information, arm yourself with information, and take a call. What I would like to tell you is that there is scientific data and evidence today to say that vaccinations are safe. That means once the vaccinations were rolled out around this time, abroad, all across the world and in India, we were also hesitant as obstetricians what to advise. So large studies in US and UK with the mRNA vaccinations, as well as for the AstraZeneca, the Covishield that we use in India, almost 90,000, 1 lakh pregnant women were vaccinated, followed up, but we did not find any adverse problem in the babies born to them. So that's our first concern when we are pregnant, that we should not do anything that will harm our baby. Fair enough, but we haven't found that evidence. So that's the first thing. Second problem, we also talk about the preterm birth. We find that in patients who develop the COVID infection are having higher incidence of preterm birth, but in patients who are vaccinated or not vaccinated, the preterm birth is the same. What does that mean? That vaccination has not increased my chance of preterm birth, right? So these are the two things you can prevent. And today, to your surprise, and what would actually turn you around is that there is some evidence that there could be some antibodies in your breast milk if you have been vaccinated in pregnancy. Just like any other vaccination, you take a Tdap. Why? Because you want those antibodies for whooping cough to go to your baby, right? So if this can happen, I'm sure all pregnant women will come forward. So today, according to any recommendation, by recommendations by our body in India, by UK, JVA, or CDC in USA, or anywhere else, there is a recommendation that pregnant women are actually higher risk of developing infection and serious disease, so they should be prioritized for vaccination if there is a priority line going on. You can take your vaccination at any stage in pregnancy. Initially, we were little hesitant in giving you in the first 3 months, because first 3 months are very important in pregnancy and can cause any harm to the baby, but we still haven't found any evidence there. So even if you are in first trimester and you have taken a vaccine, don't worry, it will not probably cause any problem. So any time in pregnancy is fine. If you had taken 1 dose before you got pregnant, please follow with the same vaccination in your pregnancy, finish the second dose. If you have already taken 2 and you are in one of those where you can get that precautionary dose, as our government has now today and announced a few days back, you could go ahead and take it. Breastfeeding mothers, please take vaccination anytime that's accessible to you. So don't deny yourself. Vaccination is your best weapon to protect yourself from serious disease. It will not protect you from getting infected. You can still have a breakthrough infection. Any variant can still, because its vaccine is not 100%. But no vaccinated person today is in ICU. So that's important.
Also, once the baby is born, when is there any possibility that we will soon be having also the vaccination for the younger children. Right now, we have the 15 to 18 has been announced. So, are there any studies that have been done to show that, like vaccination needs to be done in either newborns or very young children?
Not aware of that, Dr. Shinde. I don't have that information right now, and I don't think anybody has specifically targeted newborns right now because they are a small population. The transmissibility is in the population which is mobile, right? So I think going to children is a good idea because children are very mobile and they have also been losing their school and education for long. So we need to get back. And I hope 2022 we will be able to get our kids back to school and colleges, which should be the priority right now.
We absolutely hope so. Is there anything else that you would like to tell our viewers generally about, also about pregnant mothers and their, because we do advise them to take their daily fitness, daily walks and things like that. So that's still all right, isn't it? Wearing the mask.
Yes.
Yeah.
And if you are in a complete open space where you feel that people are away from you, you can even take out your mask and go for a walk in the park. So we need to use logic and common sense. And I think all of us are capable of it. So we should not be at that extreme that everywhere we should be masked up. Neither we should be at that extreme, oh, kuch nahi hoga, I don't need to mask up. No, that's not correct. So remember that this is an infection which passes from people to people when they're in close contact with what they breathe out, spit out, or whatever comes out with while they're talking or sneezing. I have to protect myself from those things. How do I protect? I cover myself, right? So we have traditionally women cover their face in India, in many parts of the country. Maybe for some time we'll do that, the others also. So look at it in a positive way. We can protect ourselves. The other thing to the viewers, I'd say that we have today talked about Omicron and pregnant women. But if you look at the spectrum in any country, pregnant women form only a small part of the whole women population. In the last 2 years, being gynecologist, I have come across numerous times when women have ignored their other problems as the back and haven't come forward because they are either looking after other people or they think that problem will wait, pandemic will go away. But as I said, we have to live with this virus. So don't ignore your other gynecological health issues. Could it be pain? Could it be heavy bleeding? Or you may be suffering from disease like fibroids or endometriosis or infertility. Don't put it on some place where I will address to it later. Address it because it's also important to get well physically. And these things that you are trying to push away will actually affect you mentally. You need to remain in good mental and physical place to be able to take care of yourself and your family. So don't ignore anything. We are available for you anywhere.
Yes.
We are available for you online. We are available for you in clinics, in hospitals. So please feel to reach out any one of us in whichever media you would like to, and we are there to help you.
Absolutely. Thank you so much, Dr. Rooma Sinha, for this wonderful discussion. And viewers, yes, as doctor said, we are available 24/7 on various channels. We're there on video consultation, we're there on telemedicine, we're there on the 24/7 app. We are always there to respond to your emails and queries on the website, on our social media channels, on the phone. And we are spread out throughout the country through our clinics and hospitals. So do not hesitate at any time to contact us. And above all, we would like you to not only stay healthy and safe, but also stay calm and positive. So we would like to say that we are always here for you. So do contact us and connect with us anytime you need. Signing off now. And as Dr. Rooma said, let us again remember SMS, which is the social distancing, mask and sanitization, and of course the vaccine and the precautionary dose now if you're eligible. Stay well, stay healthy, take care. Thank you and namaste.